Tumor exclusively seen in parotid gland is A. Mucoepidermoid, B. Adenoid cystic, C. Warthin, D. Pleomorphic adenoma. Tumor exclusively seen in parotid gland is A. Mucoepidermoid, B. Adenoid cystic, C. Warthin, D. Pleomorphic adenoma. Well, what do you think is the correct answer here? You can see from the image. Any guess? Tumor that is exclusively seen in parotid gland. Mucoepidermoid, adenoid cystic, Warthin, pleomorphic adenoma. What is the correct answer here? It is Warthin's tumor. It is exclusively seen in parotid gland. Fish classification is used for. Fish classification is used for. A. Paravertebral tumor. B. Synovial sarcoma. C. Glomus tumor. D. Retroperitoneal tumor. So this Fish classification is used for the glomus tumor. This Fish classification is used in glomus tumor. So the correct answer here is C. Glomus tumor. Best prognosis of all thyroid cancers. Of all the thyroid cancers, the best prognosis. See the image also carefully. A. Papillary. B. Follicular. C. Medulloblastic. D. Anaplastic. Now we all know that the best prognosis is papillary cancer and the worst prognosis is anaplastic cancer. Best prognosis is papillary cancer and the worst prognosis is anaplastic cancer. In cases of cancer breast, with HER2 new amplification, when will you do fish? In cases of cancer breast with HER2 new amplification, when will you do fish? A. HER2 new 1 plus, B. HER2 new 2 plus, C. Irrespective of HER2 new, and D. HER2 new 3 plus. So what do you think is the correct answer? HER2 status of cancer breast is routinely done by IHC study. What is IHC study? Immunohistochemistry study with values from 0 to 1 plus 2 plus 3. Recently, fluorescent in situ hybridization is used to detect HER2 amplification. So the correct answer is HER2 new 2 plus. So correct answer is B, HER2 new 2 plus. In case of cancer breast with HER2 new amplification, when will you do fish? When it is HER2 new 2 plus. Most important prognostic factor of cancer esophagus is A. Length of growth, B. Depth of involvement, C. Histology grading, D. Immunohistochemistry. It is the depth of invasion. Now the prognostic factors of cancer esophagus are depth of invasion, lymph node status, presence of distant metastasis, resection margin, serosal or peritoneal involvement, vascular invasion. So the most important prognostic factor of cancer esophagus is A. Length of growth, B. Depth of involvement, C. Histology grading. D. Immunohistochemistry. So the correct answer here is depth of involvement. Other prognostic factors of CA esophagus, as I have told you, it is lymph node status, presence of distant metastasis, resection of margin, serosal or peritoneal involvement, vascular invasion. Which of the following is not true about GIST? What is GIST? Gastrointestinal stromal tumor, GIST. The four options are A. Rarely occurs in stomach and duodenum. B. Universally associated with c-KIT oncogene mutation. C. Size and mitotic index are best predictors of metastasis. D. Sensitive to hematome. Now let us know a little about GIST. GIST is most common in stomach, up to 50% of cases. These are of mesenchymal origin. The incidence is equal in males, that is, males is equal to females. This is universally associated with c-KIT oncogene mutation. Imatinib tyrosine kinase antagonist has 80% response rate. Imatinib, which is a tyrosine kinase antagonist, it has 80% response rate. Mutation in exon 11 of c-KIT are particularly sensitive to drug. Mutations in exon 11 of c-KIT are particularly sensitive to drug. Size and mitotic index are the best predictors of metastasis. Size and mitotic index are best predictors of metastasis. Clinically, GIST are very rare, 1 to 3% of all GI tumors. So, not true is rarely occurs in stomach. As I have told you, it occurs most commonly in stomach, almost 50% of cases. Let us move on to the next question. Increased level of 5-HIA hydroxyindole acetic acid is seen in which disease? A. Carcinoid tumor. B. Phenylketonuria. C. Pheochromocytoma. D. Gastronoma. Increased level of 5-HIA is seen in carcinoid tumor. Okoda staging is for A. HCC, B. Pancreatic cancer, C. Hepatoblastoma, D. Renal cell carcinoma. It is hepatocellular carcinoma. Identify the triangle shown in the image. A. Callots triangle, B. Hepatocystic triangle, C. Gastronoma triangle, D. Domes triangle. It is gastronoma triangle. Gastronoma triangle or Passaro triangle, about 70 to 90% will be located in the gastronoma triangle or Passaro triangle. It is at the junction of CBD and cystic duct, junction of neck and body of pancreas, junction of second and third part of tube. So, gastronoma triangle is junction of CBD and cystic duct, junction of neck and body of pancreas, junction of second and third part of duodenum. Most common presentation of bile duct cancer is A. Pruritus, B. Jaundice, C. Gallbladder enlargement, D. Weight loss. Now, most common presentation of bile duct cancer is jaundice or elevated LFT. The gallbladder is palpable in distal growth due to obstruction. Gallbladder is palpable in distal growth due to obstruction, which is known as Courvoisier sign. Minority cases present with itching. So the correct answer here is B. Jaundice. Elevated LFT, that is jaundice. Most common site of cancer penis is A. Glans penis, B. Prepuce, C. Shaft, D. Coronal sulcus. Most common site of involvement of cancer is penis, that is squamous cell cancer. Glans 50%, prepuce 20%, both glans and prepuce. It is glans penis. Recent FDA approved drug as first line of treatment along with platinum based chemotherapy in stage 4 non small cell is erlotinib, B. Geftinib, C. Sorafenib, D. Crizotinib. It is Geftinib. Administration of approved Geftinib for first-line treatment of patients with metastatic non-small cell lung cancer with most common types of EGFR mutation is Geftinib is a EGFR inhibitor. So the correct answer here is B. Geftinib. Chang staging is used for A. Retinoblastoma, B. Medulloblastoma, C. Ewing sarcoma, D. Rhabdomyosarcoma. It is medulloblastoma. Chang staging is used for medulloblastoma. Craniopharyngioma is a brain tumor arising from A. Rat case pouch, B. Neurohypophysis, C. Posterior pituitary, D. Median eminence. Craniopharyngioma is a brain tumor arising from rat case pouch. These are benign cystic lesions that occur most frequently in children. It is from rat case. It is median eminence. Most common pituitary adenomas are A. Growth hormone secreting adenomas, B. ACTH secreting adenomas, C. TSH secreting adenomas, prolactinoma. 30% of pituitary adenomas are prolactinomas, 20% are non-functioning, 15% secrete growth hormone, and 10% secrete ACTH. So the correct answer is prolactin. Most common intracranial brain tumor in adults is A. Astrocytoma, B. Metastasis, C. Meningioma, D. Oligodendroglioma. It is metastasis. Kaposi sarcoma is caused by A. HIV-1, B. HPV-16, C. HTLV type 1, D. Human semen virus 40. It is HIV. Soft tissue tumor of extremity most commonly metastasized to A. Lung, B. Liver, C. Bone, D. Lymph node. It is lung. Most microsurgery is done for A. Cutaneous melanoma, B. Dermatofibrosarcoma, C. Squamous cell carcinoma, D. BCC phase. It is BCC phase. Most common type of soft tissue sarcoma in children is A. Embryonal rhabdomyosarcoma, C. Alveolar sarcoma, D. liposarcoma, D. leiomyosarcoma. It is embryonal rhabdomyosarcoma. The tumor with high frequency of spontaneous regression in children is A. Medulloblastoma, B. Renal cell cancer, C. Lung cancer, D. Retinoblastoma. It is medulloblastoma. High frequency of spontaneous regression. Other tumors are malignant melanoma, retinoblastoma, neuroblastoma, choriocarcinoma, renal cell carcinoma. Pheochromocytoma, if extradenal, are most commonly located in A. Posterior mediastinum, B. Superior mediastinum, C. Anterior mediastinum, D. Middle mediastinum. It is posterior mediastinum. Idea of adrenal biopsy should be made after ruling out A. Adrenocortical carcinoma, B. Metastasis, C. Pheochromocytoma, D. Cushing syndrome. So when you do adrenal biopsy, you should always rule out pheochromocytoma. So the correct answer is C. Pheochromocytoma. Most common malignancy of vagina in infants and children is A. Embryonal rhabdomyosarcoma, B. chondrosarcoma, C. Melanoma, D. leiomyosarcoma. It is embryonal rhabdomyosarcoma. Frey syndrome is due to injury of which of the following nerve branch? A. Trigeminal nerve, B. Vagus nerve, C. Facial nerve, D. Glossopharyngeal nerve. So the correct answer here is trigeminal nerve. Auriculotemporal nerve is postganglionic parasympathetic nerve, which on injury during parotidium results in gustatory spetting syndrome known as Frey's syndrome. So it is trigeminal nerve. Please attend the 2-day Neet PG Breakthrough Blueprint event. Click the link in the description to join. The first 10 subscribers and the first 10 people who click the link will get the masterclass free. Wishing you all the best.